Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. The Family Health Podcast is brought to you in partnership with Things Happen, a trusted financial advisor that supports new parents and their families. Things Happen offer the best advice to help parents and their families make informed financial decisions, ensuring a secure and tax-efficient future for their children. The team at Things Happen are highly qualified financial experts who will guide you through the different types of policies to consider as your family expands, taking the stress out of decision-making by finding the best deals for your needs, ensuring you and your family are protected no matter how busy life gets. If you already have life insurance, Things Happen will carefully review your existing policy to ensure that it still meets your family's evolving needs, so you know your family is fully protected. Hello, I'm Kate Ball, founder of Mini First Aid. Welcome to our podcast, Family Health by Mini First Aid. I'm always delighted that you've taken the time to listen to our podcast, because whether you're in the car, you're cleaning the house, or perhaps you're getting that well-earned cuppa, our Family Health podcast covers a huge range of topics that might affect one of your family members. And if you've ever got a family health concern and you're thinking, I'm just going to Google that, please don't. Please have a listen to us instead. Now, I'm thrilled to announce we have two guests this week. Pip Davis, a practicing midwife and co-founder of Midwife Pip Pregnancy and Postpartum Support. And I'm also joined by Caroline Hughes, a support services manager at the Meningitis Research Foundation. Ladies, a warm welcome to you both. Thank you for joining us today.
Thanks for having us, Kate. I'm really excited to talk about a subject so close to our family's hearts.
Brilliant. Yeah, thank you so much. We're really pleased to be here.
Ladies, we're going to talk about Pip's experience with her son Alfie, who is actually just off camera, and you may be treated to little sounds from Alfie during our podcast today. We're keeping this very real. Alfie contracted meningitis at just 5 weeks old. And Caroline is going to help us with a more general discussion about what meningitis is and how parents can feel more confident spotting some of the signs and symptoms. But first, ladies, I'm going to hand over to you. Can you tell me a little bit about yourself and what you do? Pip, tell us a little bit about yourself, first of all.
Yeah, of course. So I'm Pip, maybe better known as Midwife Pip, which gives the game away a little bit. I'm a practicing midwife, both in the NHS as a delivery suite sister and a pelvic health specialist. But I also support women through my exclusive Your Pregnancy and Postnatal Journey programme as well. And I guess most importantly, I'm a mum. So I'm a mum to two little boys. I have a 3-year-old Finley and their little 4.5-month-old Alfie, who is probably going to be squeaking away in the background of our conversation today. And I guess all the things that I do, Kate, in terms of, my Instagram, I've got a book out, Midwife Pip's Guide to Positive Birth, and my podcast, Midwife Pip Podcast. The whole ethos, similar to yours in a different space, it's really just about supporting and empowering in a world where there is so much inaccurate, conflicting information that actually makes the job of being an expectant or a new parent really confusing and harder.
Absolutely.
When actually it should make it easier. So really just making sure that people have that informative, empowered experience that parents deserve, I think, on this incredible journey of pregnancy and parenthood.
Brill, thanks, Pip. Caroline, tell us a little bit about yourself and what you do.
Absolutely. So I'm Caroline and I'm the Support Services Manager at Meningitis Research Foundation. My responsibility is to oversee all of the vital support opportunities for people who have been affected by meningitis. So that includes responding to people's questions on the helpline, giving advice, providing support, general or emotional, if people have been affected by meningitis. We undertake important outreach to groups that we know to be more at risk of meningitis or who might be vaccine hesitant or experiencing health inequalities. And we have a wonderful ambassador program, which is made up of people who have lived experience of meningitis, who use their voices and their experiences to talk about what they've been through, raise awareness, and particularly looking in their local communities as to how they can raise that awareness there. It's a really rewarding role, and I'm so proud to be part of that support that we can provide for people across the UK and Ireland who have been affected by meningitis.
Caroline, thank you. I think we need to come to you first in the sense of understanding about meningitis, because there might be people listening that go, okay, I've heard of it. I know the name. I recognise the term meningitis. I recognise that it's probably something that's quite serious, but that's where my understanding stops. So, Caroline, before we hear from Pip and her story with Alfie, tell us about meningitis. Help us understand it in really easy layman's terms. What is meningitis?
Absolutely, and completely agree with you. It's a really complex illness. There's a lot to it, and there is a lot of myth and misinformation out there. So it's great to have this opportunity to kind of try and clarify it a bit. So in really simple terms, meningitis is the swelling of the meninges, which is the lining around the brain and your spinal cord. And that lining is there to provide impact and protection, infection protection. So if you hit your head, that liquid should be there to give you a little bit of protection, and it should help combat infection as well. Meningitis is caused mainly by germs entering the body, and it causes that swelling, and because of your skull there's nowhere for that swelling to go, so it puts that pressure back on the brain, and it is a really immense amount of pressure that happens very quickly. The germs that cause meningitis can also cause sepsis, and meningitis and sepsis are both life-threatening illnesses that can sadly kill within hours. Now, within meningitis, there are various types. I think this is part of what causes a lot of the confusion. So different germs, such as bacteria, viruses, and fungi, can cause meningitis if they invade the body. Bacterial meningitis is usually more serious than other forms and will require urgent medical attention. Viral meningitis is almost never life-threatening, but it can still be a really unpleasant experience for people to go through, and people can be left with long-term after effects as a result, such as headaches or post-viral fatigue. And then there's fungal, which is very rare in the UK and Ireland, but it is still a very serious form of meningitis.
How common then, we talk about rarity, but just in general, how common is meningitis in the UK then, Caroline?
Yeah, so fortunately, due to our really thorough vaccination programme in the UK and Ireland, meningitis is now very rare. The vaccines that we're offered at all different stages of our lives are in response to those more risky times. Nevertheless, it is estimated that there are several thousand cases of meningitis in the UK every year, and meningitis can affect anyone at any age, but there are certain factors that we know can increase the risk. So we know that babies and young children are at increased risk because their immune systems are not fully developed. That's why there's quite a lot of vaccinations at that age to give them that extra boosted protection. We know that teenagers and young adults are at increased risk because they're more likely to carry and spread the bacteria to others. And that's in settings particularly like university halls of residence, where there's lots of people in one place, those big shared accommodations that people live in as students, lots of people coming together with different germs all around the world. And then we know that there's older adults who are at increased risk. There's a vaccine at that time as well. And then there are some medical conditions that can affect the immune system and increase the risk of meningitis as well.
So when we're talking about that category of higher risk in or being more common in babies, I think this is the point where we can bring you in here, Pip, because, well, I'm really sorry that Alfie, when he was so little, was so poorly. But before we carry on our conversation today, just to reassure everybody that's listening, tell us, Pip, how is Alfie now?
Shall I show him to you?
Yeah, we're looking if you're watching.
You can't see if you are listening, but to reassure anyone, that's sort of concerned or has gone through this journey, he is perfect, thriving little, almost 5-month-old. And, we've had monitoring, etc. afterwards. And there's nothing at the moment that concerns us other than a little bit of gut sensitivity from all the medication. There's, nothing else significant that, is of any concern, which is a massive relief to us, but I'm hopefully to other people listening as well, because when you're in it, it's obviously really, really scary.
Amazing. Now, talk to us about the story then with Alfie, and take us back to your first suspicions that something might be wrong, because you're in tune with your baby, and something with parent instinct for you kicked in. So talk to us about what happened with Alfie and when he was poorly.
Yeah, absolutely. So I suppose the day prior was just like a completely normal day. We were all at home, all did our normal activities, and went to bed as normal that evening. And then about just before midnight, Alfie woke up with an absolute scream. And he, prior to the meningitis, had some refluxy symptoms. So we'd been quite used to a baby that cries, to be honest, and is uncomfortable. But there was something about that cry at that time on that night that was completely different. And both my husband and I were like, what's wrong? Like, this is different. This isn't the normal Alfie response to anything. I picked him up. He was in a next to me crib at the time, picked him up, and he just felt absolutely boiling and was completely unconsolable by anything that we tried to do. Thankfully had a thermometer at home, so I checked his temperature and his temperature was 38.4. And I guess one of the key triggers that's probably useful for all parents to know is that any high temperature in an unvaccinated newborn under 8 weeks should be treated as an emergency, because you don't know what's causing it, but because they're so vulnerable, it's really serious. So at that point, we phoned for an ambulance because we knew he needed to be seen urgently. My husband stayed at home with our 3-year-old that was nicely snoozing, and I went in with Alfie. So yeah, I think that just knowing something's wrong is so important. And even if we didn't have a thermometer, if parents haven't got a thermometer at home, you can know when your child feels like they've got a fever. There is like a superpower, I think, in parental instincts of picking up your child and knowing they feel hot, like you know they've got a temperature. So even if you haven't got a number to put on it, don't feel like that should, I think, persuade you from getting urgent medical attention if you think your child needs it. Alfie then became quite mottled. He became really sleepy, and I was used to having an uncomfortable, refluxy crying baby, not one that was really floppy and sleepy. And then we were, eventually seen and treated at that point for sepsis of some sort. So Alfie had cannulas and bloods and was started to be given antibiotics. He then had a lumbar puncture, which is, as I'm sure Caroline will talk us through, the way that we can screen for meningitis. And Caroline will know more about the logistics of this, but one of the result from Alfie's lumbar puncture had to be sent off to a lab to test for, the levels of it. But the response that they triggered at the local hospital we were at suspected meningitis straight away. We then had to wait to see if it was the viral meningitis or the bacterial meningitis. So we had all the treatment for bacterial meningitis at that point, because as Caroline said, that's the most serious, and until you know it's not that, you need to treat for it. They also treated Alfie for anything else that may cause such a kind of poorly reaction. So he had lots of antiviral medications as well as the antibiotics, and lots of fluids because he was really floppy and not really responding. He had to have a couple of lumbar punctures, so he was exhausted as well at that point. So he had lots and lots going on, and it was, for me as a mum, absolutely terrifying. I'm used to, I guess, being the person giving people information about their babies being poorly, and being on the other end of that was very strange and unsettling. We were looked after by a consultant who I know really well and I'm used to working with clinically. And for me, that was amazing. And I know that was a real privilege for me to have that, because I couldn't advocate for Alfie when he was that unwell. So I literally said to her, do what you need to do what you do for your child, because I couldn't separate my medical brain and my mum brain. I found that really hard. And naturally, I didn't want him to be pumped with antibiotics. I'd worked really hard to take probiotics in pregnancy and protect his gut health and breastfed him to, try and make him be this thriving individual. I didn't want to obliterate that with antibiotics. Equally, I didn't want him to have such invasive procedures like lumbar punctures. I didn't enjoy holding him down for him to have cannulas put in. So I found that mum brain really, really difficult, and I needed somebody else to say, no, this is serious and this is what we have to do. And I was really grateful that the medical team could do that for Alfie, because I just, as his mum, I was like, well, I don't want him to have pain inflicted on him. He's, tiny and my precious little man. It took, we were probably perhaps slightly unlucky because we were in on the early hours of the Friday morning. So it was Friday morning that the lumbar punctures were performed. So it took until the Wednesday for us to get a definitive result where they could decide that it was definitely viral, and we could therefore kind of discontinue everything and go home. So we were in for a little while. And yeah, it was the most terrifying experience of my life, and I wouldn't wish it on anyone. But I'm so grateful that, you know, he's now this happy little thriving baby, and I think that's something that's so easy to take for granted.
Gosh, Pip, there's so much that to unpick there in the sense of the experience that you went through, and just how poorly that little Alfie got so quickly. Just to go back then, Caroline, to the symptoms that Pip has described, and she talked about this high temperature that Alfie had, and that's a key symptom of meningitis, isn't it?
Yeah, so it's really interesting actually. So for babies under 3 months, temperature may be high, it may be low, and it may be fluctuating between the two. So I think Pip's advice about really trusting your instinct on whether the temperature feels right or not is really important with that age group, because it's not always as simple as they're just super hot or super cold. There are a few key symptoms to be aware of in babies, and they're listed in full on our website, meningitis.org. We've got them for different age groups, because obviously older children and adults can tell us a little bit more about what they're feeling. Babies, we have to try and work it out for ourselves. But for babies of Alfie's age, some really key ones to watch out for. So there's the tense or the bulging soft spot on the top of the head. Thinking back to that swelling of the lining of the brain, there may be something that you could actually see or notice there. That temperature could be high, low, or fluctuating between those. They may be very sleepy, they may have a staring expression, they might be too sleepy to wake up, they might be breathing very fast or have difficulty breathing, there might be extreme shivering, they may see that meningitis pinprick rash that lots of people will have heard of, but just to be clear, that may also look like marks or purple bruises, and it can be anywhere on the body. Babies will sometimes have diarrhea. They may make a very unusual, quite distinctive grunting sound that will sound quite different to other noises that they'll have made. They may be vomiting or refusing to feed. They might be quite irritable when picked up with a high-pitched or a moaning cry. They might have blotchy skin that gets paler or maybe even turns a kind of blue shade. They might have a stiff body with jerky movements, or else be floppy or lifeless. And they might be in some pain, so there might be some irritability around that. And I think it's interesting hearing Pip's story. Quite a few of those symptoms seem to come through from that. And what we say that's really important to note is that not all babies will get all of those meningitis symptoms, and symptoms can appear in any order. So that's why it's so important to be aware of all of them, so you can try and pick up a bit of a pattern of what you're seeing. And again, really trust your instincts. You as a parent know your baby best, your child best. If you think something's not right, if it doesn't feel correct to you, we really encourage you to act on that.
Yeah, and just from Pip, when you were talking about just this instinct, and I think your phrase you used was, that's not like Alfie, and that cry that you referred to. And our instinct is a really, really powerful thing. And quite often a medical practitioner may say, is this normal for your baby? Or does your baby do this? And being able to say no and recognise those symptoms. Pip, you talked about having an older son as well, another little boy. So you're about to go to hospital. If we take you back to you're about to go to hospital, how do you do the logistics when you've got a baby who's seemingly very poorly and needs urgent medical attention, but you've also got another small person at home that you need to think about as well? Where does your mind go with that?
Yeah, it's really hard, isn't it? I guess as any parent, you almost go into like adrenaline overdrive. So at the time, we're lucky in a way, I suppose, Kate, that we have 2 children and there were 2 adults in the house. So it's a little bit of that divide and conquer. And then in the daytime, you know, navigating how can we get support from grandparents or someone to come up and then relieve my husband, who amongst it all probably had one of the most challenging parts, I suppose, of the juggle, because I was very much in hospital with Alfie, just focusing on him. Mm-hmm. Our wonderful 3-year-old wasn't actually bothered by my absence, which is savage, isn't it? But that's the way of a 3-year-old when you're busy and your life's carrying on as normal. And because to start with, we didn't really know what was going on other than he was very sick and we had to just wait and see what happened. I didn't really want Finley coming up to hospital when he wasn't bothered about my absence, to be honest. That was only going to help me, not him. And I didn't want him to see his brother poorly. And I felt like leaving me was going to cause him more distress than not seeing me. If he'd been begging for me and that had been an issue, then we would have re-navigated it. But we decided that we would try and keep Finley's routine as normal as possible, because he had also just adapted to having a new sibling. So there was massive change going on in his little life. So my husband would make sure he was home to either drop him to nursery or pick him up, or, do whatever in the day that needed to happen. We'd actually delayed his paternity leave. It's almost like someone was looking down on us. So he had just started his paternity leave that week. So we didn't have to worry about him going to work, which was great.
Okay.
He then put Finley to bed, and then my mum would typically come and sit in with him. So James could then drive to the hospital for a few hours and then would drive back at like 2 a.m. to then be there for when Finley woke up. So he was exhausted by the time we got home.
I bet.
But it was just that, that important thing about actually, how do we protect him and not make him scared of hospitals? So I didn't want him to think that his baby brother, who he seemed to really like, had taken mummy away from him, or that hospitals were a scary place. And we didn't really have any answers to give him because we didn't have answers ourselves. So how on earth was he going to kind of understand the situations? It definitely felt more of a juggle having two little people than if it was just one, and it would have been our kind of sole focus on Alfie. One of the other things I guess wanted to go back on when we were talking about kind of symptoms was when we sat with the consultant afterwards, when she was like, when we sort of were talking about lumbar puncture, she was like, it's absolute worst case that it's meningitis. Hopefully it's not, but we need to rule it out. And then she came back in shortly after to say, no, it is meningitis, Pip. And we started having a bit of a chat then about sort of symptoms and signs and history. And it was at that point that I recognised that actually I'd enjoyed the fact that day that he'd been sleeping beautifully. Okay. I was like, he's nailed some naps here. This is great. And it had been quite a warm day, and we'd been for walks, we'd been in the carrier, and he typically likes sleeping, just blowing some bubbles, typically likes, sleeping in the carrier and things. So very much signs that could also be completely normal for a new baby that in reality you're still getting to know, when they're just over a month old. And then when we'd gone to bed that night, I'd said to my husband, it's really annoying. He's got a real preference for one breast, because Alfie was exclusively breastfed. He's got a real preference for one breast tonight. And so one was getting really engorged. And then in hindsight, we were like, that's his neck and probably that pain in his head. But at the time, again, how often do babies have a preference for one boob and it's just, the way they are, or their tummy's a bit sore, so they prefer lying on one side. But it was only really in hindsight, to be honest, that we kind of thought of those as symptoms. At the time, they were just little inconveniences or changes. But absolutely, if you're a parent where those symptoms were to worry you, you don't have to wait until the point where we were like, oh gosh, no, something definitely is wrong. Because honestly, like hand on heart, until he woke up with that scream, I really didn't think there was anything wrong. And if the same was to happen again, I still don't think I would have done anything differently, because I just wasn't concerned. And I didn't know him that well at that stage.
Yeah. Now, Caroline, talk about the lumbar puncture. So Pip mentioned that Alfie had to have a lumbar puncture. In fact, Pip, you said he had to have two, didn't you? People may be familiar with the term lumbar puncture. Some people may have never heard of a lumbar puncture before. Tell us what it is and how a lumbar puncture is performed, and then talk about what they're testing for. So what are they doing in the process of doing a lumbar puncture?
Yeah, absolutely. So a lumbar puncture is currently the only definitive way to diagnose meningitis and what is causing it. And a lumbar puncture, which you may have also heard of called a spinal tap, it's the process of inserting a thin, hollow needle between the bones of the lower back and taking some of the fluid called CSF out. And that fluid is the same fluid that's in the meninges that's lining that brain and spinal cord. So testing that fluid can then help doctors confirm whether the patient has meningitis, what type it is, and what kind of bug is causing it. The quicker a lumbar puncture is performed when meningitis is suspected, the more likely it is that that cause will be found. However, in some instances, doctors won't perform it, or they might delay, and that might be because the person's actually just too ill at that point to go through with that. I appreciate all of that probably sounds horrible and quite frightening,
Yes.
but it is a routine procedure and medical teams will have experience of carrying these out. And it is really important to get that diagnosis as quickly as possible so that the correct treatment can be given, whether it's viral, bacterial, what type of bacteria. And the quick diagnosis will help minimise potential after effects, help the person start to feel better more quickly. And it's also really important for aftercare as well to know what's the best course of action for them further down the line to make sure they're as well as they can be.
Great. Now, working, Pip, in the medical profession means that you have this knowledge. So unlike some parents who are told that their baby has to have a lumbar puncture, when somebody or when the consultant told you that procedure was going to need to take place, you knew, Pip, didn't you, what that meant?
Yeah.
How difficult was that for you as a mum versus your medical professionalism and also knowing what was going to need to happen for Alfie?
Yeah, really hard, Kate. So I remember my husband was there at that point. And I can't remember it must have been in the morning after nursery drop off that we decided that he needed a lumbar puncture because he was then present, and times are like a complete blur, aren't they? Mm-hmm. But I was crying before they came in, and my husband was like, "What's wrong?" And I was like, because his inflammatory markers were all, obviously sky high, and I knew what that meant. And I was like, they're going to say there needs to be a lumbar puncture, and they're not a very nice procedure because I've held babies down for them before. I'm very aware of exactly what that looks like. And he was unmedically trained. My husband was very much like, well, if that's what he needs, and that's fine. And because I'd gone with him for all of his cannulas and antibiotics and things, he was like, we'll just go with him for the lumbar puncture. And I was like, I promise you are not going to want to go with him for it because you can't do anything as a parent in that situation. It's really important that babies are kept really still. So as a parent, you're basically in the corner of the room. So it's really traumatic for you and is of no help or consolation in reality to your baby. So I was trying to explain to him that actually that wasn't going to be very helpful for anybody. And so I knew in my heart of hearts it was absolutely the right thing to do. And if I was speaking to a patient or, parents that I was supporting, then I would 100% have been recommending that as well. But I just could not make that decision for my child. I just couldn't be the person to say, yes, let's put him through a lumbar puncture, despite knowing rationally it was fine. But by this point, I'd been awake, hadn't slept, was, just emotionally drained, so worried about him. And that's where it was amazing that I could just say to the team, you just tell me what to do and that's fine. I completely trust you. And I just really lent into the medical team taking care of us, which I know perhaps we are talking about you. Ironically, as we talk today, he's got another cold, which is what caused all of this in the first place. But,
bless him.
The joys of having a big brother at nursery. But yeah, for me, it was amazing to be able to completely lean into them. And it didn't mean I didn't ask questions or, they gave us all of the information and very much supported me to make an informed choice. But they made it so much easier for me by just being really black and white in terms of we wouldn't do it if he didn't really need it.
Yeah, sure.
And gave the full explanation and in kind of a layman's terms to my husband as well, so that he was, completely au fait with it. And so, yes, we agreed to it, but I just needed someone else to make the decision for Alfie, so I didn't feel like as his mum, I was making that choice.
You were making
in terms
that
of putting him through something uncomfortable.
We often, when we hear about meningitis, we hear about this rash, don't we? And Caroline, you mentioned the features of the rash and how the rash can present. And we often teach in our mini first aid classes, we talk about the non-blanching rash. And most people, I think, would say, oh, yes, I've heard of that before. Because there's been mass education for us, hasn't there, around the rash. But you don't always get the rash. Alfie didn't get the rash, did he, Pip? Is that right? Did he not get the rash?
Yeah, he never had a sort of meningitic rash, we don't think. He did become really mottled, and at one point the team were like, that could be a rash, but also it could be that he is fighting some sort of infection, and he's dehydrated, and it could be linked to that. So we're not really sure whether it was a rash or kind of a mottled experience, kind of appearance to all of his skin from being unwell. But yeah, definitely, I think one of the things that the team did mention to me was that certainly with Alfie, the rash was to some degree a bit irrelevant because it's often the last sign of meningitis as opposed to one of the early ones.
Yeah, okay. And Caroline, would you say that now in meningitis awareness education, this piece around not waiting for the rash is really important?
Yeah, absolutely. So, as I said before, when I was listing those common signs and symptoms, not every baby will get all of them and they'll not get them in a particular order. So, it's about, I suppose, being aware of them all and picking out a bit of a pattern of, oh, actually, I've got this one and that one, and I'm starting to put this together, and I can see they're, potentially getting worse in front of my eyes, and picking up more symptoms and responding to that. What we do know is that the first symptoms are usually things like fever, vomiting, headache, and feeling unwell, which is difficult because that could be a whole host of different things. And we also know that the limb pain, pale skin, cold hands and feet, all of those things often appear before the rash as well. Something that's really distinctive about meningitis is how fast acting it is. So if you start to put together these signs and symptoms and build up a bit of a pattern and think, oh, actually, I think I really feel something's not right here. As I said before, really trust that gut instinct and seek medical attention for your child if you think something's wrong.
What we'll also do, Caroline, I know you've referenced the Meningitis Research Foundation website, meningitis.org, but what we'll also do is we'll share the links and symptoms checker in the show notes, so to make sure that everybody feels that they have them to hand and that they understand them. Pip, once you had the lumbar puncture and you then waited, didn't you, a number of days, because you said you waited for a number of days for the for diagnosis. What treatment was Alfie going through whilst you were waiting for diagnosis, and what treatment did he have ongoing?
Yeah, so while we were waiting for the diagnosis and they were assuming worst case bacterial, he was on antibiotics through a cannula in his hands, feet, wherever they could put them by the end. He was also on acyclovir, which is an antiviral medication that treats against herpes, because again that can flag similar symptoms. So they wanted to treat him for that in case, until we knew exactly what we were dealing with. The downside of the acyclovir medication is it's really aggressive on veins. So he was literally getting through cannulas sometimes every single dose every day.
Oh, bless him.
So he was really, really bruised. Alfie was also having fluids because he was just too poorly to feed as well as we would have liked. So I was really grateful to have some lactation support while I was in with him to sort of protect my milk supply, because I really wanted to be able to continue to breastfeed him afterwards. He was having lots of regular observations. He was attached to a monitor constantly to kind of keep an eye on all of his observations. So yeah, lots. I guess it felt like we were constantly being checked on, to be honest, and he was constantly due different types of medication. When he was clearly uncomfortable, he was having some paracetamol as well, which when he had it orally, he absolutely loved. We'd be like, oh, it's sweetie time. I think that was probably the only highlight of the whole thing to him, was getting this lovely paracetamol. But one of the other things that we did, and actually really stands out in my mind when we were inpatients, was there was a point where he had all of his lines had come out accidentally or because of the issues with the veins. And we were waiting for him to have other cannulas put in. And one of the lovely nurses said to me, while we're waiting, should we give him a nice bath? And that was honestly the most kind thing, because it meant I could do something normal with my baby.
Yeah.
And you know what all of the monitors are like. They leave horrible sticky marks. He was covered in scratches and rashes and, had bits of cotton wool and tape all over him and plasters. And it was so lovely. And I think, when you feel unwell, having a bath or a shower makes you feel so much nicer. So actually that it's probably 5 minutes that he was in the bath before a doctor came. But that 5 minutes of me just being able to do something normal with my baby, get all of those marks off of him and put him in some nice clean clothes and things, actually meant so, so much. And on the outside, if someone had said that in that little bath in hospital would have been such a big thing for me, I would have been like, oh, don't be ridiculous. But actually, it's one of my big memories was how nice that was. It was kind of rebonding, I guess, with my baby after what we were going through.
And he was tiny. I mean, he's 5 weeks old. I think, that's the bit sometimes when we're having these discussions on the podcast is that, we forget that sometimes these cases we're talking about very little people. He really was a very new baby. And you're very new into being his mum as well, building that relationship, that bond, and all those things that you crave, that you want to do normally together. Pip, did Alfie, or has Alfie, I mean, I know he's well now. Generally, I know you said he's got a little bit of a cold at the moment, but he's better. Has he had anything of any concern or any long-term side effects or symptoms having been so poorly at 5 weeks?
Yeah, so nothing that we're aware of at the moment. He's had hearing screening since, and some monitoring, which is all normal. He's been followed up by the consultant. Everything seems normal. Developmentally, he seems great. I guess in the kind of short term, what he did have was he was really locked through his neck. So when we got home, we noticed that he could literally only look backwards and over to one side. So we've done lots of massage and been seen by an osteopath to help with that, which now is great. He's got great mobility through his neck and through his spine, which is grand. He does suffer with his gut, so he's got sensitivities to dairy and soy and oats, which we'll work through in the grand scheme of things. These are very minor, but ultimately, we have to recognise that all the medication he had essentially just bleached his gut and his insides, and that was needed and necessary and absolutely fine. But it's kind of just a bit of a rebuilding process for him at the moment. But long term, and in terms of development and hearing and all the things that perhaps people might associate with meningitis, he's thriving. He's great.
That's amazing. Now, Caroline, there are, in some cases of meningitis, there can be some long-term effects. What happens in some cases with some people's recovery or some children's recovery from meningitis?
Yeah, so sadly, there are potential after effects for people who have experienced meningitis, and they can be temporary or permanent. They could be emotional, behavioural, physical, a real variety. And that's really something I've noticed working here, is actually how varied people's experiences are of all stages of meningitis, so being in hospital, diagnosis, and then those after effects. Some of the more common after effects that are likely to be caused by meningitis, and I think if you think back to that swelling around the brain and around the spinal cord, some of these actually make quite a lot of sense. So memory loss, lack of concentration and difficulty retaining information, clumsiness or coordination challenges, headaches, as you can imagine, after what your brain's been through, deafness or hearing problems. So meningitis is the leading cause of childhood acquired deafness, and we know there's a lot of very sensitive little bones and structures within the ear. Again, all that pressure could have damaged some of those. Related to that, some people have tinnitus, loss of balance, dizziness problems. Some people can have epilepsy or seizures, weakness, paralysis or spasms, challenges with their speech, loss of sight or visual problems. Again, all of that pressure in that same area. Mental health challenges or challenges to personality or behaviour, and acquired brain injury. And for young children that have experienced meningitis, that's why it's so important to keep an eye on their development, as some of these challenges may not become apparent until the child gets older and begins using and developing new bits of their brain. And as that comes into play, it might then become obvious that actually there's some things that they're struggling with a little bit, and there's support available for that. And just to say as well, it's really important for parents and carers to look after themselves too during these experiences. You've been through such a traumatic experience. We've heard it from Pip, who's bravely talking about it today, what it's like for parents. And actually, you really need to be kind to yourselves, look after yourselves, and give yourselves the time that you need as well to heal through the process.
I was going to ask you, Pip, how did you guys put yourselves back together after that huge, massive shock and worry when Alfie was so little? Are you both doing okay?
Oh, we are. I think talking about it helps. I think being able to educate other people, because in all honesty, we didn't know that much about meningitis. Like, I have, a bit of knowledge about the postnatal ward that we test babies for meningitis on, but we didn't have massive knowledge. So actually getting educated. I guess Alfie showing us the signs of reassurance was amazing. And I'm not saying it was really tough, I had flashbacks in the night. I was constantly checking him, constantly worried about him. It was like we were really grateful. Sorry guys, I just get his stomach. Yeah, constantly worrying about him. We were really grateful to be discharged home, but equally getting home was then like another terror because I wasn't able to monitor his temperature constantly and his heart rate constantly, and he was obviously still recovering from a big old ordeal. Little milestones that we've allowed ourselves to recognise. So, for example, I was delaying taking him swimming because I was so scared that he'd get something else or, he'd be unwell again. And actually, when we did that for the first time, I was like, oh, look how far we've come. And
Yeah,
I think
amazing.
Getting him vaccinated was a great sense of reassurance because I knew then he had that kind of immunity to help him. I was then worried every time he got a cold that it was going to be this nervous wreck, that it was going to turn into meningitis again. He's got a cold at the moment and I don't feel terrified it's going to turn into meningitis, which I couldn't have imagined feeling when we first got home. So I think that just taking those mini milestones and allowing yourself to recognise kind of all those things, just feeling incredibly lucky. And I think it puts, whenever anyone's ill, regardless of age, I think it just puts life a little bit into perspective, doesn't it?
100%. Absolutely.
For us, that was very much the case. So yeah, his smiles in a way just feel extra precious, because we obviously didn't have them when he was so poorly. But actually, when we were discharged, when the consultant came to let us know we could finally go home, is when he actually did his first ever big smile, and it was so lovely, so lovely. So yeah, we'll definitely hold on to that moment. But yeah, I feel very grateful for our NHS for sure.
Amazing. And may there be many more milestones. You'll have to keep telling us about them on your social media. Caroline, it's so important that people know what the symptoms are and what they need to be checking for. Can you just, for the young babies, run us through those red flag symptoms for when it comes to meningitis, what parents and carers need to be aware of?
Yeah, absolutely. And just to remind everyone, the full list of those symptoms are available on our website, meningitis.org, and they have different age categories, which is really helpful as well. So for babies in particular, you're looking for tense or bulging soft spot on the top of the head. Again, thinking back to that swelling. You're looking for high temperature, but it could also be low if they're very young or fluctuating. They might have diarrhea. They might be making quite distinct and unusual grunting sounds, vomiting or refusing to feed. They might be quite irritable when picked up with a high-pitched or moaning cry. They could have blotchy skin, which gets paler or turns blue. They might have a stiff body with jerky movements or else be quite floppy or lifeless. They might be very sleepy, vacant, difficult to wake. They could have that pinprick rash, but again, it might look like marks or purple bruises anywhere on the body. They could have that pale or mottled skin, breathing fast or breathlessness, and have that extreme shivering, cold hands and feet, and fever and or vomiting.
So Caroline, with today's podcast, with the Family Health Podcast, people listening today have, I'm sure, embraced Pip's story and learnt from your expertise. Is there one thing that you would want, if it's possible to have one thing, but is there one thing you would want people to take away as a message from Meningitis Research Foundation for what you'd want people to take away from listening to today's podcast?
I do, yeah, and I know I've said it a few times, but I do think it's really important, so I'll repeat it. Parents must trust their instincts, and if you think something's wrong, check on your child often because meningitis is very fast acting. And as we've said, early symptoms of meningitis can look like lots of other things, but meningitis will get worse quickly. So if you suspect your baby or child is poorly, even if you've been told not to worry about it, act on those instincts, tell medical professionals that you're concerned about meningitis, make sure you're aware of those signs and symptoms so you can spot those patterns and trust yourself through the process. As we heard from Pip, she knew something was wrong when she bravely told us about those signs and symptoms that Alfie had, and that's so important. You know your child and your baby best, and you've got to trust those symptoms and trust that feeling if you think something isn't right.
Thank you, Caroline, Pip, and beautiful Alfie, who is beautifully sat there now. He's holding on to a rattle. Gorgeous. Pip, tell us what you would want from people hearing your story and what you've been through as a family. What would you want the takeaway for people listening today to be?
Yeah, without completely replicating, I guess, Caroline's key thing, it really is to trust that parental instinct, whether you're the mum, the dad, a carer, actually knowing that you know your child best, and it's absolutely fine to be seen and then to be, rest assured that everything's absolutely fine. It's so much better to do that 100 times over than to miss one thing, especially in such small babies, because we do know their immunity is so weak. So something that we might fight off, so Alfie probably had a cold to start with, something that we fight off actually for them can be really serious. And especially I think if you're a first time parent and everything's naturally more concerning, then absolutely fine to seek medical attention and get that reassurance. Never feel like you're wasting anyone's time or anything like that at all. It's what people are there for. I've always said to mums that when I'm awake on labour ward all night, there's no point me being up all night on labour ward if you're sat at home worrying about something. And the same goes for, any other side of the medical profession. So if you are worried, that is enough of a reason to get help. You don't need to have anything else particular to report.
Brill. Pip, Caroline, thank you so much for joining the family, and I should say, and Alfie as well, for joining the Family Health Podcast today. Please do subscribe to the Family Health Podcast via your favourite podcast channel. You can also sign up to the Mini First Aid newsletter, where we cover all sorts of family health and wellbeing advice, including such subjects as meningitis, as we've been talking about today. If you want to see what Caroline or Pip look like, never mind us, let's all look at baby Alfie because he's gorgeous. Then you might want to watch the podcast on our YouTube channel, and you can do that now. If there are other topics that you would like us to discuss on the Family Health Podcast, we love hearing from you because it enables us to bring the guests on subjects that you particularly want to hear about. You've been listening to the Family Health Podcast. Thank you for joining us. Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. And just a little reminder from me and our sponsor, Things Happen, that if reviewing your life insurance is still on your to-do list, take time to get in touch with a Things Happen advisor today.